it's also a decision patients have to think about, because you got to remember, with elective surgeries, it doesn't just necessarily mean it's a surgery that is not needed. It can also mean it's a surgery that's not needed right now. Maybe you take some antibiotics. Maybe you just deal with the pain for a few weeks. So again, for hospitals and patients alike, having to make some tough decisions.
It hurts to go to work every day, actually, but I'm not going to die from it.
Surgeon Brittany Bankhead Kendall tore her hip labrum this summer and may now need surgery, but says she won't do it until the pandemic is over.
Not only is there a hospital capacity problem that could surge at any moment, but there's also staffing problems. There is PPE problems. And quite frankly, as a patient, if I catch COVID even after the fact, within 30 days, my prognosis is worse.
While doing her fellowship training at MGH, she was part of a global COVID study that looked at surgeries at hundreds of hospitals and found higher numbers of deaths and complications.
In those who had COVID diagnoses, and found that anyone of all surgeries, all types, eye surgery, belly surgery, orthopedic surgery, that people were having worse outcomes. They were 50% of the time.
Numbers like that have kept many people from elective surgeries, and even those who wanted to could only do so once the state lifted the ban a couple months ago. But for hospitals, the damage was done. Massachusetts Health and Hospital Association says hospitals continue to navigate highly unstable financial circumstances, having lost over $5 billion during the initial wave. Continued state and federal support now vital as cases are starting to go up again.
Just a month ago, we had typically about 20 COVID patients in-house. Then we quickly went to 30, and now we are at 60.
Doctors say at the rate we're going, it may not be long before our 650 hospitalizations turn into the nearly 4,000 we saw in April.
The numbers can double in a matter of literally 10 days to 2 weeks. It could very quickly exhaust the capacity.
There's a socioeconomic of major hospital corporations not having the influx of money, sure. But it's also people who have colon cancer and gallbladder cancer and soft tissue cancers that the longer you delay their surgery, they're farther along, their prognosis is worse.
Yeah, and all of these hospitals lost money from fewer elective procedures as well as outpatient services, but also an increase in equipment costs. UMass Memorial here was losing at the height of this pandemic $30 million a month,
Well, Governor Baker says field hospitals will be in play again. Do you think those will be used more if needed in an effort to keep elective surgeries going, which helps, as we've talked about, hospitals financially?
So field hospitals allow the hospitals to keep all of the COVID positive patients in one place. It doesn't mean you can't have COVID positive patients inside the hospital, but it does two things. It keeps the hospital itself cleaner, and what that does is allows the hospitals to make that tough decision on balancing just how many surgeries